Hello.
I'm looking for you.
Yes,
How are you doing?
I'm fine.
Okay, perfect. My name is Anastasia Bigme. Okay, I'm gonna be your clinical resident for the time that you're here. Have you seen Dr. Kuznetsov today already?
I don't know who is.
Oh, you don't know him yet. Okay, he's gonna be your operating surgeon, apparently. Okay. All right. So, I would like to ask you questions to collect some documents that you
Yes,
probably
I
have, right? Yes. So let's see what you have on your hands. Okay. Thank you. Oh, sorry about that. So this is, I suppose. Okay. I can see. Okay. Okay, this looks perfect. I think that you have everything. The only thing is, we still need, I'm not sure if they told you this when you just entered the building, you know, when like doctors are looking at you and everything, but basically, you still need to have an ultrasound of your weans. I mean, the weans of the lower limbs, okay, because this is something, you know, what's also compulsory before the operation. So then I'm guessing that we're going to be having this thing today. You know, I'm just gonna let you know when we're gonna see the doctor for that. But apart from that, I think that you are, you know, ready with everything. You have
Yes,
all
I
documents.
know.
That's amazing. That's so
Okay,
good.
thank you.
Because otherwise, you know, that's sometimes a problem when patients lack something when they come here for an operation. So I'm really glad that you were
Yes,
all
because
ready and
my
set.
friend make it all make it everything so that it will be always completed.
Good, good, good. I like the folder. Okay, let me just close the door. Um, So I'd like to ask you some questions because, you know, apparently uh, we have these papers where we mention, you know, how it all started and basically like when you first discovered that you had, and I wonder if I can even do this. Okay, maybe not with this chair. Let me try using this one. Okay, this works better. All right. So tell me, you know, how it all started in general. How did you first discover that you have something?
I was discovered since it's 3 years ago.
Okay. Uh-huh. So did you have any specific symptoms? Did you complain of something or
No,
was it
I
just like,
feel some drying throat. Like
okay.
that. But I'm not taking any medicine on just on the eyelid like this.
Uh-huh.
So
When did the goiter first appear? So like when did you first, you know, see it as a goiter?
I thought it's uh this 2021 or 20. I didn't remember.
Uh-huh. So since the year 2021, let's say?
Yes.
Uh-huh. Mm-hmm. Okay, so then you noticed it, but you didn't really refer to like a doctor, you didn't make an
Yes,
ultrasound. Uh-huh, okay, I see. Um, so then the documents that you have with you, like the results of ultrasound, for example, was that the first ultrasound that you really performed with regards to the bleeder?
yes. When my friend is here, she
Uh-huh,
accompanied me here. That's only the first time.
uh-huh, okay. Mm-hmm. But it's really good that your friend has sent you here. You know, that was a
Yes,
really,
that's why I'm so worried. So I just asked my friend to accompany me because I don't have too much know the places here,
yeah,
and I don't know also how to speak in Russian, so it's
yeah,
really difficult for me. I don't understand everything.
it makes sense.
Yes.
Yeah, it makes sense. But it's really good that you're here because it's considered like, you know, the best endocrinological institution in the country,
Yes,
apparently.
she
So
told me like that.
that's really good.
I hope so. It's all will be fine.
Of course. I'll tell you about the operation a little bit later. Okay, so I'll explain a couple of moments.
Okay.
So tell me, before this, you mentioned having this kind of a sensation of like a dry throat-ish. Did you have something else apart from that?
No.
Did you have trouble swallowing? You know,
No, I
no, nothing like
never.
that. Did you notice something like a change in your voice, in how it sounds? You know?
Just only I recognize my hair is falling and
Uh-huh.
dryness of the skin of
Ah,
my head like
when did it
that.
start?
Yes, like that, and then a little bit when I breathe
Mm-hmm.
and working is it's my breath it my heart is very fast like that. That's all only I feel it.
I wonder. Did anyone tell you anything about your tumor being hormonally active?
Oh, when that one is the first, very first ultrasound before.
Okay, I'll take a look at some tests in our electronic system as well because it might be that, you know, at the time when you were having an ultrasound and then a biopsy, maybe they took some blood tests for thyroid hormones back then, I'm hoping. Um, because otherwise I can't really see the results here. Okay, so I see calcitonin. Mhm. Oh, there we go. Okay. Um, okay, that's quite interesting because basically your hormonal profile for the thyroid gland is all right. So like,
Yes.
yeah, all of your hormones are within the reference ranges. Um, mhm. So when did you start having that heartbeat again? Like
I
when did you
think
first discover?
this year. Only
This year, this past
yes,
year?
because it's. I thought it's because it's grown already,
Right.
so that's why.
Mm-hmm. Okay. Um, do you ever measure your pulse? Like, do you know the exact, let's say, values of how fast it is?
No,
How fast
I'm
it
sorry,
gets?
I didn't.
Okay, no, it's okay. I'm gonna examine you now, so we'll see, you know, like what you have now. Do you take any medications that act to lower your heart rate? No, not really. Okay, any medications that you're taking whatsoever?
No. Only this time I came for medication like that only because I know that I have what is that good immune system, so I never get sick like that. Only
Right.
this is my problem.
Right,
Yes,
right.
only this.
So you don't take any, cardiological medications, nothing, no therapy. Okay, that's that's one of the main questions that we ask patients because it's really important before operations and just like in general, so that's why. Okay, so no meds. Okay, so then for symptoms and, your own complaints, as far as I get it, just tell me, if I'm right. You have had this, let's say, dryness of your skin, and then you have discovered that your hair fall out more than they should,
Yes,
and it's been happening for the past year, right?
yes.
Together with the increased heart rate. Mm-hmm. Mm-hmm. Do you feel this beating of your heart somewhere in your chest? Do you feel this kind of increased heart rate?
Yes, sometimes
Mm-hmm.
I feel it like that.
Mm-hmm. Okay. Mm-hmm. All right, makes sense. Have you ever had any allergies, allergic
No,
reactions?
sorry, I don't
Never.
have.
Okay. So not only to medications, maybe to pollen, some food, like products, whatever,
Yeah,
anything
no,
whatsoever.
I don't have any allergy.
Okay. All right. Um, did one of your close relatives have a similar problem with goiter or just like thyroid problems in general?
No, I don't have any family like this. Just only me.
Okay. Any family history of cancer in general?
Mm.
No. Okay. Hmm. Okay, we also ask for gynecological anamnesis. Do you still menstruate?
Yes.
Okay. Um, what was the first day of your last
Mm, last
bleeding?
or first?
So the first day of your last bleeding. When was your last bleeding, and then the first day of it?
The first day is October 2.
The 2nd October.
Yes.
Are you sure it was the last
October 2.
menstruation?
That is yeah. First day.
Yeah.
I mean, it's first day, October 2.
Okay.
And then the last is I just on October 2. Wait.
Do you have a calendar, or anything like that?
Yes.
Are your menstrual bleedings heavy, painful? Do you experience any sort of discomfort when you're having them?
No, no, no.
Not really, okay. Do you have any other chronic diseases or, states in general, like whatsoever?
I don't have.
Don't really, okay. They measured some increased blood pressure when you were like downstairs, like 142 over 91. Um, so, for the future, we're going to discuss it with um, your main doctor, but basically, I think that it makes sense to use some antihypertensive drugs on a regular basis because this is already like, arterial hypertension. This is considered hypertension. Okay.
This is hypertension.
Okay, so the thyroid gland state is a goiter. This is something else. This is something what is going to be surgically removed like tomorrow, basically, and then you're going to be getting treatment for that as well. But for your blood pressure in general, because like I mean, I'm going to measure your blood pressure now as well. But based on what I see, the result that you had downstairs, it was 142/91, which is
normal, not normal.
Everything what's higher than 140/90 is considered hypertension.
Okay.
So we're going to discuss it with Dr. Kuznetsov, who is once again your main doctor. But basically, that would be a good idea just because, you know, you don't really want it on like a regular basis, right? Anyways, but I'm definitely going to be checking your pulse and blood pressure while you're here. So we'll see, you know, how it goes and what the measures are and everything. Okay. What else is it that I want to ask you? Mhm. Okay. So you won't be needing any kind of a document that proves that you were here at the hospital for the time being, right? I mean, do you work here in Russia? Like, will you need some kind of a document proving that you were here at the hospital for the time of the surgery and everything?
Yes, before I just working.
Uh-huh.
Yes.
So will you need some kind of a proving document? We call it
No, because I don't have like that. Just only I asked my friend to
Uh-huh.
help me like that, and then she's on all to provide all everything
Okay.
that I came here.
Okay, all right. We just always ask this question because, you know, for most organizations, people need to prove that they weren't just, you know, absent at work because whatever, like they were having a vacation. Like they give some kind of a document proving that they were at the hospital. That's why I'm asking this question. Okay, all right, makes sense.
Okay.
All right. So then I think we're good so that I examine you. Okay.
Thank you very much.
All right. So let us start with blood pressure, I think.
So maybe I will come.
Of course. May I please ask you? This is going to be much better. Okay. Could you please just like put your back against the the back of the chair? Perfect. Okay. Just relax. By the way, that's the question that I also wanted to ask you. Is it your first surgery? Yes. Okay, so no surgeries before. Any traumas maybe that you've had previously? No traumas either. Okay, cool. You're lucky.
Yes.
Okay, perfect. Right now it's actually something like 135/80. This is much better. Okay. Take your wrist. And just like relax it, you know, put it in whatever position is comfortable for you. Yeah, you do have increased heart rate. Okay, all right. Got it. Could you please show me your hands like this? Mhm. Okay, now may I please ask you to stand up? Would you please take off the like your t-shirt you have? Okay, so I'm gonna listen to your lungs first. So you wanna like stand back to me. Also, may I please ask you to breathe through your mouth, so like a little bit more deeply.
Very
Mhm.
difficult. Okay.
Okay, it's all right. So you can now turn to me. No, it's okay. It's okay. I'm gonna. Could you please let me listen to your heart? Oh, okay. All right. You can now put on your t-shirt. Okay. And may I please ask you to lay down? I'm just gonna examine your abdomen a little bit, if it's okay. All right. Do you have any pain?
No,
in the?
madam.
Okay. All right. Have you had pregnancies, labors?
Yes, I have two daughters.
Okay, so then 2 pregnancies and 2 labors.
Mm.
Okay.
They are so big now.
Oh, really?
Yes.
How old are they?
22 and 19.
Oh my God.
Yes, because I was 45 already. Coming 45 this
I mean,
December.
but you are still so young, and your daughters are
Oh.
already like they're just like a little bit younger than me. I mean,
No,
so incredible. That's so great.
because I'm short only. That's
Yeah.
why.
But you look really young though.
Oh, thank you.
You know. When I put away my fingers, you have any unpleasant sensations?
Yeah, it's fine.
It's fine. Okay. All right. Mm-hmm. Any pain here? This spot?
No.
No. Okay. And let us sit a little bit. Just
Like that.
yeah. This also works. This also works. Any pain?
No.
No unpleasant sensations. Okay, great, cool. So, here's what we're gonna do. A doctor who performs ultrasound, because remember I told you about the ultrasound of our weans, okay, of the lower limbs. We're gonna get in touch in some 40 minutes-ish, let's say. So, what I know the answer as to when we're gonna go have our ultrasound performed, I'm gonna let you know, okay? So I'm gonna come a little bit in advance so that we have time to make it, okay?
Okay.
Right. Otherwise, it's perfect. I think that you might have problems with understanding because everything here is in Russian. So I'm sorry. Just in case that someone can help you, just please ask someone for help. But the lady has just invited everyone to have lunch. So you can just like follow everyone because lunch and just like breakfast, dinner, everything is served separately in a separate room. So you can go there and you're gonna have a meal. Okay. All right. Okay. So I think that from medical personnel, all doctors speak English for sure. Okay, as
I
for
hope so, so that I
oh, of course, doctors speak English. Okay, but for nurses, I'm not sure. Unfortunately, maybe some of them don't. But you know what? Just so you know, I'm gonna show you where I sit, for example. So where all clinical residents are. Are you ready to go out already? Like, if you wanna see the place where I am, just in case you need some help.
no, because one girl showed me about where
Okay.
eating like that.
So you're gonna be good.
Yes, if I ever, I don't know, I just translated and then they would know.
Oh, okay. Okay, sure. Okay, all right. But just in case that you need me, okay, just in case that you want to know something, so I'm in the room with all other residents in the other side of the surgical division, let's say. So if you just like go this way, you go to the opposite corridor first. That's the main thing. You're gonna see like basically the same part with let's say a place for nurses and then just like rooms for patients everywhere, and then I'm sitting on the right side in this big room with residents. So also if you have any questions, just
Wait, please. I forgot your name.
of course, yeah, let's write it down. You know what, you can write down my name and also my cell phone number.
Maybe it's here,
Just
Mom.
of course. Okay, this for you. So you can call me just this way, okay, but
Anastasia.
yes, right, okay. But then also, this is going to be more recognizable for
Doctor
other people.
gave me.
Yeah, okay. So for my cell phone number, if you have like WhatsApp, Telegram,
Yes,
whatever
I
you
have.
need, okay, perfect. So you can always reach me using this number.
Okay.
Okay, so if you have any questions, any concerns, please just let me know, okay?
Okay, thank you very much.
And make sure that you feel
Have a nice
comfortable
day.
because we're going to see each other, remember? Ultrasound.
Okay.
Okay. Have a nice meal.
Yes, have a nice meet too. Oh, wow. Excuse me. Here. Okay. Very nice. Snow. Anak, mabigat.
Алло, 2 часа прошло, мам, звоню. Забота. Да, да. Мгм. Как у вас дела? А я сейчас тебе еще раз набирала, тоже занята.
У тебя напикает, да?
Не знаю. А у меня просто, мам, я ждала, телефон включился, гудки прошли, там сколько надо. Ну что, как у вас, мам? Понятно. А сосед? А, вдруг отнимешь, мам? Ну, не знаю, мам, он совершенно без контроля, чем это закончится, не знаю. Никак, мам, я тебе говорю, никак. Никак, мам. Мам, у него есть дочка Юля здесь, которая хоть бы мне хоть раз позвонила. Не считает нужным. Не считает нужным, это их проблема. Ну и полная ерунда, ну. Как она могла забыть? М. Да, не важно. Не беспокойтесь там о нем. Он сейчас уже все у него уже сейчас. Ничего будет. Ну вот я говорю, не надо нам его контролировать. И Сашу я переживаю, что он туда заходит. Не надо ему заходить туда. А, то есть, ой, кошмар какой. Кошмар какой, говорю. Ой, только бы мне сделать операцию. Ну, а там что будет? Что будет, то будет. Это уже не мои проблемы, его. Как ему жить, как и чего делать. Самое главное, чтобы только бы выжил бы. Мгм. Она не поверит, что папа может кого-то толкнуть. Мгм, конечно. Мам громко говорит с соседями-то, ну. Мам, ну рядом слышно и наверху, и внизу точно так же слышно. А мам его не убавит звук, наверное, суметь. Мгм. Не надо, мам, не надо. Во-первых, ты не знаешь, там выключается на этом, не на телевизоре пульте, а на пульте вот этом. Мам, ну не громко он орет все. Телевизор я имею в виду. Вам тоже слышно, да, не так, как мы обычно. Ой, мам, не знаю. Я не знаю, мам, как соседи отреагируют. Будут ругаться, наверное, самое нормально. Да. Самое главное, чтобы операцию сделали, чтобы все нормально было. Вернуться домой. Да. А вот ничего подобного. Все будет хорошо. Я даже в этом даже не сомневаюсь, мам. Приезжают, привозят, мам, привозят после операции. Все уже сами себя обслуживают и кушать за едой ходят, и все, мам. После этой самой. Ну, она же мне сказала, что у нас тяжелых больных не бывает. Ну, вот видишь, вот бывают экстренные случаи, как в пятницу. Вот. Да, мама, у меня, боже, наверное, сегодня вторник, да? Меня бы сегодня уже, наверное, выписали бы, если в пятницу сделали. Да, раньше в пятницу, наверное, не будут делать. Господи, только все прошло, бы, нам после пятницы сделали. Господи. Я уж тут тоже устала лежать там. Ко мне вот сейчас женщину поселили, а она по-русски не говорит. Не пообщаешься, ничего. Он 45. Не получится. Да, сейчас приходил врач, так она, это самый врач, здорово, там ширует вообще. Ординатор. Ага. И Сергей Николаевич нам будет оперировать. Так что, значит, он придет. Ой-ой-ой-ой-ой. Мне бы не хотелось сейчас с ним встречаться с таким губой. Ужас. Ну я думаю, ну не садник так, мазью мажешь. Ну, и язык у меня тоже что-то, это самое, объело, тоже садник. И это самое, как назвать-то, ну они такие большие, ну-ка я мазью намаживаю, они там лопаются все, внутри-то наболевшие-то. И вот это вот как он гной это или что вот это такое выходит, вот это желтое-то. И оно все это прилипает вместе с мязью, и такие штуки получаются. Вот одна вчера оторвалась, ну, я ей еще помогла, потому что у меня повисло не то, не все. И она такая, я ей даже на ночь не мазала, потому что она такая была открытая. Вот, она к утру засохла, я ее намазала. А так все так. Ну, мне вот моя, это самая, Елизавета Юрьевна сказала, что не надо ничего самой отрывать, когда они сами отвалятся. Чтобы там внутри зажило кожа, чтобы они отвалились и были чистые губы, иначе конца и края не будет, нам не заживут-то. Ага. Ну, а он что? Нет, мам, ты там ничего с ним не объясняйся, не надо, мам. Не надо. Ты сейчас вообще вообще с ним не разговаривай. Вообще не разговаривай, когда он начухается, не разговаривай совсем. Молодец, все будет хорошо, как он мне говорил. Я говорю, ты, мам, ты там помогай, готовить-то она не сможет. Но зато у вас продуктов больше, мам. Он не ест. Продуктов больше останется. Если учитывать, что в следующий выходной никто не пойдет за продукты. Карточку ему не давай, мам, пусть покупает на свои деньги. Угу. Пусть он думает, что потерял. А ты куда ее делал-то, мам? Под клеенкой даже, да? Ага, ясно. Но они она под клеенкой. Угу. Буду знать. Ну ладно. Угу. какая змейка? А зачем вы их искали? Это убрано и убрано. А зачем они вам нужны-то, мам? Ну зачем, я же вам сказала, там лежат. Зачем смотреть-то, мам? Там у меня и коды, и все. Мам, что вы там лазили-то, мам? Зачем? Ну, вы увидели эту самую желтую папку? Желтая папка, мам. Да. Ну, вы ее вынимали, ее открывали, лазили в ней. Ну ладно, ладно, не надо, мам, все как лежит там нормально, так и лежит. Мгм. Ладно. Да уж, господи, господи. Никто же сам работает, все это сам ходит в магазин. Вспомнил, ну ладно, тоже озабочена, поэтому